Coming up on Mayo Clinic Q&A.
The Center for Digital Health has the vision of bringing Mayo Clinic to a global community so that we can deliver Mayo Clinic anywhere in a manner that is simple, that is personal. So we can deliver Mayo Clinic quality, Mayo Clinic compassion, Mayo Clinic expertise to people digitally, in addition to what we do in our bricks and mortar facilities.
Mayo Clinic's Center for Digital Health is delivering innovative, comprehensive, and complex care to patients in the comfort of their homes. Using new technologies, patients can receive the same care at home as they would in the hospital.
We have an opportunity to provide great quality care, and that if done right, it will enable people to stay in their homes more, with their families more. It will enable them to continue working more. It will cure them faster. It will do so with less expense, less frustration, and everybody benefits if we can accomplish that.
Welcome everyone to Mayo Clinic Q&A. I'm Dr. Helena Gazelka. Innovation in healthcare is being driven by technology and data, and the Center for Digital Health is Mayo Clinic's hub for this digital transformation. So what does this mean for our patients? Well, joining us to discuss this today is Dr. Brad Leibovich, Medical Director for the Center for Digital Health at Mayo Clinic. Thanks for being here today, Brad.
I'm really excited to be here. Should be a fun conversation.
Yes, I'm really excited to have you here because digital health means so many things. And so I wonder if you just kind of start by telling our listeners, what should they think of when they think of digital health and the Center for Digital Health?
Yeah, it's hard to wrap your head around everything that is digital health. So the Center for Digital Health has the vision of bringing Mayo Clinic to a global community so that we can deliver Mayo Clinic anywhere in a manner that is simple, that is seamless, and that is personal. So we can deliver Mayo Clinic quality, Mayo Clinic compassion, Mayo Clinic expertise to people digitally, in addition to what we do in our bricks and mortar facilities.
Brad, has COVID-19 had any impact on Mayo Clinic's digital approach to healthcare? It's accelerated some areas, I would imagine.
Yeah, so COVID-19 has been a huge accelerant. You're exactly right. I think it's been an accelerant in terms of regulatory issues. So previously it was very difficult for us to conduct care with people who weren't physically present with us, but because of the rules changing around the pandemic, we have been enabled to provide care to people anywhere. That's done with video visits like you and I are chatting today, but we also are able to collect medical data on people and offer more than just an opportunity to speak. I think it has, because of the regulatory burdens being lifted, and because the providers and patients were able to see the value and were forced to learn about the value in providing care this way, it has been adopted and accepted much, much more rapidly than it would have been without COVID as the accelerant. In the future, I think this will enable us to care for people that traditionally might not be able to have the time and expense to travel to one of our facilities, and will hopefully help with some of the efforts to make good quality healthcare available to a broader population.
I think that is just wonderful. I love the idea of digital health as a great equalizer.
Yeah, it's really important. And what we need is for those of us that pay health workers to understand that we have an opportunity to provide great quality care, and that if done right, it will enable people to stay in their homes more, with their families more. It will enable them to continue working more. It will cure them faster. It will do so with less expense, less frustration, and everybody benefits if we can accomplish that.
Brad, I think it would be really illustrative for our listeners if you would tell us a little bit about some of the key initiatives that the Center for Digital Health are working on.
Sure, we think of them as pillars. So the sort of pillars of our digital strategy are how do we transform the digital consumer experience? So the goal, the expectation is that when people are thinking about a great digital experience in the future, they're not going to talk about how easy it is to use their iPad or how easy it is to shop on Amazon. They're going to be talking about Mayo Clinic as the exemplar for the best digital experience. And in so doing, as we've been discussing, transform the way we deliver healthcare. So making it easier, making it less frustrating, making it less expensive, less time consuming, while enhancing quality and while restoring a lot of what physicians miss, which is the face-to-face human interactions. Right now, we hear so many complaints about physicians spend so much time in front of a screen, so much time interacting with computers. If we do this digital transformation correctly and empower our physicians and the teams that support them and the institutions that support them with the right tools, the technology will fade into the background and the human component of healthcare will be restored. So we're going to transform healthcare both within Mayo Clinic and outside of Mayo Clinic. And we will position Mayo Clinic to be a clear leader in the delivery of healthcare, not only in our bricks and mortar facilities, but digitally.
I like that example that you gave, Brad, because literally every time that I go in to see a patient in an exam room, I say, give me just a moment. I'm going to log into the computer so that I have it ready. And I have our electronic health record pulled up.
Right.
So
if that electronic health record supported you correctly, you would be briefed on that patient. Everything would have been presented to you in a manner that's easy for you to digest. You'd know everything that's pertinent about that patient for what you need to do for that patient. And you wouldn't need to look at the computer because you would have been briefed. But when it came time to share information, you could do so in a way that's unobtrusive. So instead of looking at the computer and looking at the patient,
right,
you and the patient can have a conversation with the data that you need to share with them displayed between the two of you in a manner that's easy for them to digest, easy for you to explain. And then at the end of that interaction, instead of having to go do a whole bunch of, let's face it, drudgery to document and to do the record keeping that takes so much time nowadays, all of that stuff should be taken care of for you, again, enabling you to spend more time with your patients.
Oh, I love that idea. Brad, tell us a little bit about Advanced Care at Home and Mayo Care Anywhere.
Sure. So Advanced Care at Home is one component of Mayo Care Anywhere. So Mayo Care Anywhere is a suite of products. So these are products that allow us to do exactly what we've been talking about. Advanced Care at Home provides hospital level care. So think of people that traditionally would need to be in the hospital for a serious condition. Instead, being enabled to stay in their home, having nurses and physicians checking on them via technology, and having data streamed to those providers from their home. So we enable them to remain home by bringing what would traditionally be hospital level equipment into the home and having continuous interactions with them. It's a great service. And through COVID in particular has enabled us to maintain our capacity in the hospital for people that really need care that can't be delivered at home. Other products like that would be much lower level care, but still more than just a video chat. So think of remote patient monitoring for things like less acute COVID, or for high blood pressure, or for people that have a heart condition. So these are things that we can monitor in patients' homes, but they're not necessarily hospital level care. We have over 500 patients enrolled in that sort of a remote patient monitoring system at any one point in time. And we typically have up to 40 patients that are being cared for at any point in time with this Advanced Care at Home.
I have seen that in action, and that is really, truly amazing to me.
It is amazing. And again, it is what our patients expect of us. So when possible, how do we keep them in a supporting environment? How do we keep them at home while still delivering that super high quality care and allowing the handoff. So if somebody is, in a remote patient monitoring situation and they become, more sick, they need care at a higher level, we can transition them to the advanced care at home, and then if necessary, even into the hospital and back down, so that people get the care where it's appropriate, and we can deliver that super high quality on the patient's terms instead of on our terms.
So Brad, I have just a question about sort of the philosophy of care at home. I'm thinking that years and decades ago that we did care for people at home. Their primary care physician would go into their home and see them if they were ill. And then we started building hospitals in the United States and brought people into hospitals. And now we're bringing them home again. Is that just because we have the technology now to do that?
I think that's probably the majority of it. Yeah. If you think about when people used to do house calls, really all you had were a couple medications,
right,
a couple bandages, a stethoscope, and that was it. Now we have very advanced diagnostic and therapeutic tools. And up until recently, it just wasn't possible to do an EKG, heart monitoring in somebody's home. Now that's easy, and we can transmit the data and the team can see it. There are so many tools that enable us to monitor patients at home that have only recently been available to us because of improvements in technology. And then, of course, the ability to transmit large volumes of data so that we can see things happen to these patients in real time and react in real time as we need to.
And what an incredible advantage to the patient to be in the comfort of their home.
No question. Yeah, the patients love it and the providers love it.
Brad, what innovations do you see coming that will be most helpful to patients? We've talked about some of them already, I think.
Medicine is all about getting the right sort of data. And, it doesn't matter what sort of a physician you speak with. In order for that physician to care for that patient, in order for that advanced care provider to care for that patient, or that nurse to care for that patient, they need to intake large sums of data. So what we do now is we have these individual sporadic touch points, unfortunately, usually when something has gotten bad enough that we have to start looking for data about something that's gone wrong. I think the real value will be when people trust us to look at the data that we can collect on them in their day-to-day existence, and we take advantage of the ability to collect large sums of data from wearables and from other things in their environment that know what's happening with them, that we can then predict when disease will occur and prevent it, or if we can't prevent it, take care of it at an early stage when we can take care of them more simply in their homes. Or if it does require something major, a hospitalization, a move to one of our actual bricks and mortar facilities, if we can ingest all of that data and get data on them before they come, we can make their time away from home shorter, their time in hospital faster, and improve the quality significantly. So, physicians can only process so much data, but if we build systems around all of that data to provide insights to that physician team, and we can assemble those teams virtually around patients and pick experts from all over the globe as necessary, then the quality of care will be improved. So it's really at every level, predicting and preventing, diagnosing early and treating simply, or when necessary, enhancing our ability to rapidly restore health and provide cures. That's how we're really going to transform what patients experience in healthcare to make it less obtrusive and to keep them healthy and happy at home.
What an exciting time to be in healthcare, Brad, and particularly to be working in digital health as you are. It kind of is akin to when you think about antibiotics being discovered, and then all kinds of antibiotics were discovered, and it changed the face of medicine. And we've had a few things like that, and the digital transformation reminds me of that.
Yeah, one of the other aspects of the Center for Digital Health is our data and analytic teams. And they are responsible for helping us assure that we have the data streams that are available to our care teams and others to help assure that we can deliver on this promise and to build the tools to interrogate that data. So think about artificial intelligence and machine learning, processes that automate certain things. It's important, I think, to understand that all of that unlocks the potential of the really great physicians and allows them to take better care of their patients. I think a lot of patients and providers see the discussion of things like artificial intelligence and machine learning and big data as, you're trying to replace a physician, a caring doctor, a caring nurse practitioner, or a caring nurse with a machine. And that's not what we're talking about at all. What we're talking about is enabling them to do an even better job by providing them these tools.
Any last comments to share with the listeners?
No, we're really excited that they're along for this journey. Please, help us help you. Let us know about your ideas for us to innovate and how we deliver healthcare digitally. We've only barely scratched the surface of what we hope to do. We have hundreds of projects that are in the pipeline, and we really expect that healthcare will be better and will keep you healthier and with your families more. So thanks for your attention.
Brad, I was delighted to have you on today because even being here at Mayo Clinic, I feel like digital health and the digital transformation is almost a part of every aspect of what we're doing and where we're going with Mayo Clinic in the future. And so I enjoy learning more about it from you.
Well, thank you for the opportunity. It was fun to talk about.
Our thanks to Dr. Brad Leibovich, Medical Director of the Center for Digital Health at Mayo Clinic, for being with us here today to talk about digital transformation. I hope that you learned something. I know that I did. We wish each of you a wonderful day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.